So you have a patient, and they've either been diagnosed with CRPS or you've diagnosed them with CRPS, and thank you very much for doing that. Especially if it's the right diagnosis, I'm glad that you found it. What do you do at that point? So you have this diagnosis, and when patients read about CRPS online, I can tell you that they'll come back and they'll be devastated. It's in some ways as bad as giving someone a cancer diagnosis. They really feel that this is it. Like their life is done, and it's not. Okay, so let me make sure that's clear. It's not. There are many options available, and options that honestly could potentially reverse or put CRPS in remission. Okay, we've seen that, and we're not the only ones who've seen that. Other people have seen that as well. So it's possible, but it definitely takes a commitment, and it takes effort, and it takes understanding of knowing what options are out there. So obviously, option number one, the first thing you're going to do is start with some of the most basic treatment options, right? Things that you would probably do anyway. Things like maybe for pain, you would look at acetaminophen, or you'd look at NSAIDs, right? Maybe you would look at heat or ice. But remember, sometimes that's incredibly hard because patients can't tolerate anything on their skin. Like, you'll have patients coming in, say, listen, I don't wear clothes, I don't wear socks, I don't wear anything because I can't, it's so hypersensitive. So those kind of things may not actually work. Topicals may not work. In some cases, topicals will work. Remember, I talked about a spectrum, right? So we have patients who are very hypersensitive, but they can actually tolerate topicals, and in those cases, topicals may actually be helpful. But moving on, beyond those, there are other medications that we can use, the nerve pain type of medications, the muscle relaxant type of medications. I'm not going to mention any brands or any molecules by name because that's not the purpose of this video. So you're going to see that I'm being pretty broad in general. Even opioid medications, right? While they don't help with CRPS mechanistically, because again, CRPS is a central pain condition, it's a neuropathically active central pain condition that involves neuroplastic changes. Opioids are working on mu receptors. Okay, there's totally different mechanisms of action. But patients who have CRPS are going to have peripheral manifestations, and they're going to have pain. And even though the opioid might not help with the CRPS, it might help quell some of that pain, especially when you have really bad flare-ups of pain. I am not an advocate of using opioids for everyone. I'm definitely not an advocate of high-dose opioid medications. In fact, I was the first physician, I'm pretty sure, in the country to predict the OxyContin epidemic in 1999. Before I was even a physician, I was the first physician or first to-be physician to work at the World Health Organization's Department of Substance Abuse because I felt so passionate about this impending problem that took everyone else 15 years to figure out. While that's being said, we don't want the perversion of the opioid epidemic. And the perversion of that is, hey, they're all bad. No, look, certain patients need certain treatments. It's when we don't know how to provide the right treatment or the right molecule for that patient or the right technology for that patient, that's when we run into problems. Very similar to another modality that's becoming popular, cannabis. Many years ago, I was in the news media in a pretty well-known outlet, talking about how cannabis can absolutely be helpful, way before it was legalized medically or recreationally. But I also said at that time, we have to be careful how we utilize that treatment, because if we're not careful, we're going to have a lot of people having side effects, and that's really the key here. Side effects with opioids, side effects with cannabis, side effects with muscle relaxants or nerve pain medications or with any sort of modality. We have to understand those. We have to know when to do things properly and when not to do things. But opioids can be an option. There are certain molecules, again, I won't mention them here, but certain molecules that actually have dual mechanisms of action where they can work on the mu receptor, but they can also work on nerves and nerve receptors and NMDA receptors, which is one of the key receptors that we see with central sensitization and CRPS. Physical therapy is a wonderful modality. Again, you got to have someone who understands CRPS and they understand that, hey, we're not just trying to strengthen a muscle, we're actually trying to reverse a process where the brain thinks that the extremity is disconnected, or the extremity is not working, or the extremity is undergoing an active injury. So they need to understand how to do physical therapy where they involve both extremities. Mirror box therapy is another option. Aqua therapy is another option. Some patients, again, are not able to do it because they're not able to tolerate the water. Some patients can do it. But therapy of multiple different types is important. Mental therapy, okay, not because the patient is nuts, okay, but because we have to address the fact that centrally what is going on. We're seeing chemical changes, we're seeing neuroplastic changes, we're seeing nerve connections that are forming, that are aberrant formations. And what we want to do is sort of redirect those aberrant formations into the correct sort of nerve connections. The connections that have always been there saying everything's normal. And so mental therapy that can occur in many different types. I mean, it could be just talk therapy, it can be cognitive behavioral therapy, it can be biofeedback. We've used things like brain mapping. Even some apps that are out now are really trying to focus on patients trying to be able to sort of understand the disease process and trying to, almost create this positive energy or this positive thought process that's going to hopefully get them to switch that switch back to the way their brain used to perceive problems and used to perceive pain from the way that the brain is now perceiving it. And let me take this moment to point out that perception of pain is not a voluntary perception of pain. This is how the brain is evolving. Your whole personality is changing. Your whole perception of the world is changing. You are literally becoming a different person without wanting to become a different person. This is not a conscious process. It's an unconscious process. However, through conscious processes, we can potentially, hopefully, change the direction of that ship and right it. There are other treatment options that are available. Interventionally, there's something called a lumbar sympathetic block or cervical sympathetic block, also called a stellate ganglion block. And those are used to try to reset the sympathetic nervous system and try to disrupt this sort of hamster wheel. We've used spinal cord stimulators, a way of overriding painful signals with non-painful signals. They work, but obviously if you look online, there are a lot of failures too. And those failures can be for many reasons. Again, assuming everything was done correctly, some of those failures exist simply because of the fundamental mechanism of action. We have a central pain condition that's causing peripheral symptoms. And those peripheral symptoms can actually cause peripheral damage, which then tells the brain again, hey, we've got a problem, and then the sort of cycle continues. The spinal cord stimulators are trying to break that cycle. But sometimes that cycle doesn't necessarily break, and we see a failure with those devices. Ketamine infusions have been remarkably effective in our practice in breaking that cycle of pain. Why? Because ketamine is a NMDA receptor antagonist. What that means is it's binding to that NMDA receptor and antagonizing it or blocking it. When we can use the right dose for the right patient, along with a lot of other adjunctive medications, okay, kind of creating that perfect soup for that patient, the perfect amount of different things that live in harmony, that will work just right for that patient's brain, we are actually seeing a reversal of those symptoms or a remission of those symptoms on the spot. I mean, patients are leaving saying, oh my gosh, I can actually shake your hand, I can touch my leg, I can eat food, okay? Important small steps that are absolutely meaningful and life-changing for patients. Now, it doesn't last forever. None of these things will last forever in and of themselves. If you take a medication, you don't reverse the process. If you do physical therapy, you don't reverse the process. If you do a stimulator or an injection or even infusion, you're not going to necessarily reverse the process forever. Why? Because that neural circuitry has changed. And for that switch to flip back and forth, it doesn't necessarily take much. It could be any type of trigger. It could be a trigger of a memory that's already there, and those memories are what are sort of causing the brain to kind of spool up or wind up. Or it could be a new trigger, okay? This is what's complex about the whole complex, CRPS that we describe. Other treatments have been described as well. Things like IVIG have been described, and that's helpful with the autoimmune secondary effect that we see with CRPS. There are some trials using bisphosphonates, and they've been helpful when we start seeing bone-related side effects, which we see with CRPS. Other options include things like lidocaine infusions. Lidocaine, trying to help with the peripheral nervous system, peripheral nerves that have been affected. And there's some other things on the horizon too that we are seeing. Currently, we also see electrical therapy, external electrical therapy through a variety of different branded and non-branded options. We're seeing microcurrent therapy as well. Hypnosis has been used. If you look at how all of those modalities are trying to help, again, they're trying to help the electrical system. So try to look at it more from an Eastern medicine standpoint, chi, flow, energy flow. We're trying to get everything to sort of be in harmony with each other again. And really, honestly, that's not much different than what we're doing from the Western side. Trying to get everything in harmony. We're trying to get this wind up, this spool up, this hamster wheel to stop. And so hopefully it will spool back up, it will reboot the normal way and not the abnormal way.